Hi everyone. Today we'll be discussing fibroid. Fibroid is a growth in the uterus. It could also be called myoma uteri, and it grows in different parts of the uterus and in different forms. So most times it is seen either on the outside of the uterus or inside of the uterus. And inside of the uterus, it can also be seen in different positions. So what is fibroid all about? Fibroid is a growth in the uterus that affects a reproductive age group. Now, when we talk about a reproductive age group, we're talking about between the ages of 12, 12 to 45, or sometimes to 55 in some ethnic groups. Then, in some places, it's between 18 to about 45 years of age. However, fibroid could be seen in this age group, but is more paramount among the ages of 30, those between the ages of 30 to 50 years of age. Now, what happens in fibroid? Once one develops fibroid, you discover that there's an increased menstrual flow. You begin to have what we describe as heavy flow. And in between the flow, that's the statement of a particular time of your flow and the previous one or the next one, you discover that you bleed intermittently. Most people, once they start bleeding intermittently, they look at it as though they are having a kind of infection. This might not necessarily be attributed to infection, but it could be as a result of fibroid. Now, once fibroid sets in, there are so many things you got to see. Now, let's talk about the symptoms, okay, before we talk about other things. One of the symptoms you're going to notice once you develop fibroid is what we call increased menstrual flow. Your menstrual flow will become higher. So, in some people, it will last for days. Like some people that are used to having 3 days bleeding will now start bleeding for 5 days, 7 days, some even up to 10 days. And those that use like a pad in a day will start using like 3 pads, 4 pads in a day, well soaked. So you begin to ask yourself what is really going on. And most times you will not even know that you have a fibroid until you present to a hospital that you're having a menstrual bleeding, a heavy menstrual bleeding, and something related to that. And your doctor evaluates you and discover that you're having fibroid. And that will now direct you to the cause of the heavy bleeding you're having. More so, fibroid comes with pain. Now, it can either come with low back pain or lower abdominal pain, depending on the area of the growth. Most times, the growth comes anteriorly, it grows more anteriorly, and most times, if it is positioned in the way that it affects the back, that's when you begin to have lower back pain. And there are things we call pressure symptoms. Some of the pressure symptoms is when it grows anteriorly, it makes you to be urinating almost every minute and second. If you having the urge to urinate, then there's also a way it will grow anteriorly. It will block your bladder. Then you would now have difficulty to pee. You cannot urinate even when you have the urge to urinate because there's already a kind of pressure that is blocking the bladder from allowing the urine to come out. Then it could also cause what we call low back pain if it grows anteriorly, posteriorly rather, and that's towards the back. Now, it will cause low back pain. Then, if it grows um, posteriorly also, it will also result to what we call pressure on the rectum. Now, once it results to pressure on the rectum, you will not be able to evacuate your bowel, like you cannot defecate at ease. So if you go to toilet, you'll be having the urge to defecate, but there's something that is preventing you from defecating. Then there could also be constipation, because at this point you're no more defecating. For days you will stay without defecating, so it will result to constipation. Then other symptoms you're going to have is what we call bloating or fullness. You just see for some people, I just noticed that the abdomen is gradually growing. So once it starts growing like that, some of them will even attribute it to pregnancy. Some of them will just assume that they are pregnant, but that's not really pregnancy. So it is advisable you go to a hospital for proper evaluation so that you know what is causing you the bloating. Then we now ask, what are the risk factors that are really there? Once it is there, we'll say that this person might have fibroid. Now, you ask yourself, what is the major cause of fibroid? Now, generally, the major cause of fibroid is not known. Nobody knows the cause of fibroid. But there are some factors we look at as though this one could contribute to fibroid, or this one could predispose somebody to having fibroid. One of those factors include what we call high body weight. Once you're fat, let me just put it that way, if you're fat and your body mass index is high, now you have the chances of developing fibroid. What happens is your body will now expose you to high secretion of estrogen. And estrogen is one of the hormones that contribute to this. So once you start having high secretion of estrogen, there are two hormones that controls this. Now, in the presence of pregnancy, we'll talk about progesterone. But once pregnancy is not there, estrogen will be there, and once your body weight is high, there will be high secretion of this estrogen. Then another factor that could predispose you to having fibroid is once there's history of fibroid, meaning there are some genes that have been assessed to say that they have high tendencies of causing fibroid to somebody. Now, that's when we say it is genetic. That means probably your parents, your mother, or your siblings are having fibroid. So you have also high chances of having fibroid because that gene is already running in you guys. So once it is there, then you have high chances of having fibroid. Then another key risk factor is nulliparity. When we talk about nulliparity, it means you've not had a child before. Like some people will stay, even the book of law says that there's time for everything. Some people will stay at 30, they don't have a child. At 35, 40, you don't have a child. Just as one of my lecturers, my chemical pathology lecturer, would always tell us then, that if you have a farm and you don't plant anything in the farm, grasses will grow there. So the grasses that grow in human is seen as fibroid. So because there's nothing there to take the place of the fibroid, so the fibroid will definitely be happy to grow there. So that's what happens. Once you stay long without having a baby, it predisposes you to having a fibroid. Then some people will put to birth of a child now and stay for like 10 years before they will think of having another child. It will also predispose the woman to having fibroid, because within this space there will be high secretion of estrogen. Now, then there's another factor we also consider as early menarche, like girls that started seeing their menstrual period very early in life could also have high chances of having fibroid. Then another thing is when your menopause comes at a very late stage in life, you also have high chances of having fibroid. So in the next video, I'll be talking about the treatment of fibroid, what you need to do in order to help yourself and prevent fibroid from attacking you. And another questions that may be asked could be, could fibroid cause infertility? And can one also have pregnancy and fibroid together? These questions will be tackled in the subsequent videos. So thank you so much for listening. Kindly like, share, and comment. Thank you.